Hello, welcome. This is Dr. Gerard Cuomo. I'm here with the all-on-4 fixed, implant fixed, and implant supported upper prosthesis. And we'll go through and just show you, this is 1 week post-op now. And I want to show you the fracture site. We were right through here, and the repair with both metal and using the same type of acrylic. We were able to fix the problem. Now, the question arises, well, do we hand tighten versus 15 Newton centimeters? And hand tighten for me is pretty close to that. So I verified by going in and checking each screw, and I did not feel any unloosening whatsoever. So I'm going to go ahead with our Teflon, and that'll get a nice cover for each screw head and also the composite that we'll use. So that's the next steps, and then after that we'll remind our patient to be seen every 3 months to have the prosthesis removed and the implant fixtures cleaned thoroughly, and the denture base can go into tartar and stain remover, cleaned, and then the same screws reapplied and retightened. And then on the third time I would suggest new screws to replace the old prosthetic screws. And that's it. So just to watch here, I'll walk through the steps. All right, so just drying off, and I need the air syringe. We just condense. First of all, start on the upper right. Air first. Okay, and we'll get the first part of that started. I'll need a condenser, small condenser, and we're just going to take the end of that, and we'll push that in with a condenser like so, and hold it, and I'll use the other end and just push it in place like so. Ideally you want to get, I would say, about close to 1.5 millimeters, 2 millimeters of thickness of composite, and we may be a little too much on our material, so let's see. This is where a back action plugger would come in handy. Something that has another angle. Scissors, please. I'm just going to condense a little bit more. There we go. Let's make sure the whole head is covered. Okay. I'll just suction that. Compress the rest. We also were treating a flare-up that he had on the left side and right side. We saw some pus and exudate came from a couple of the implants, more so on the left side than the right. And the patient was put on amoxicillin for 1 week, and that has since subsided. We'll look at that tissue right after I place these. All right. Let me have one more condenser, and I'll just look at a little larger one if I can. Yes. You know what? I'm gonna take this one and reduce it a little bit. I'll just cut a little bit off on this one. Okay. A little too much. Let me push that back in place. Big. That's better now. About 2 millimeters thickness. Okay. I'm just going to go tail first on these. All right. You get the idea. And then what we'll do is come back and place a composite that's both a dual cure composite. I'm going to use whale dense paracore material, so it's dual cure. But we'll cure it with the light to speed things up and then polish. And then we also want to recheck the bite because we did add to the posterior region, and the bite gives us the ability to distribute the forces more evenly. So we want to check his bite in back. So we built up 3 areas on each posterior side. Next one. This one's a little deeper though. And there's the other one is, let me see if I can use this for the other. Might be more shallow. No, the other one's is deep. Obviously these vary in height because of the amount of bone loss. Okay. Right now they're about 6 millimeters in depth, so we want to add just a little bit more. Mm-hmm. Okay, the key is just to get the tip in there, and you get an even condensation. Instead of catching air, you want to be able to push it and get it started first, and then condense that, and then bring in the rest of it. Okay, suction posteriorly. I have a saliva ejector in there. I have a periodontal probe. Okay. So we're right about 4 to 5 millimeters in depth there. Same on that side. Or just about 2.5 there. About 2.5 there. So I'm going to go a little bit more on each, so there won't be any struggle later on to remove these. Suction on. that away. Pack the rest in. And just remeasure that. It's about right. Go a little more on this other one. And just get it started. That should be plenty now. Okay. I'll just check this one. I think 2 millimeters is a good number, 2 to 3 at the most. That's right about what we need. Recheck that. Okay, so basically we're going to reduce our light. Have our bonding light ready. And paracore right in. There's no need to add any resin, any adhesives, because we're in metal. There we go. Okay, so we let that just overfill and then cure it. All right. Transfer left. Close a little. So you can see how well that area, I'm just going to tip you down a little bit, just to see how well that area healed where we had a fistula track. And the tissue's all closed in nicely and healed. So we did have to incise it a little bit. So after we did that, just placing him on an antibiotic is half the battle. You have to incise and drain the site. And so that worked out well for him. This site as well seems to work well. And we're on a little timer here as far as this material. It's already set by light, but we're going to let it go all the way to, I believe it's a 3-minute timer, 3 to 4 minute timer after light curing. So what I'm going to do is set up to polish, basically a finish burr, which we use in composites quite often. And That's pretty solid. But all we're going to do now is just polish these little buttons down so that they're all flush with the denture, and check the occlusion. In fact, we could check the occlusion while we're waiting. None of these are hopefully not interfering. Close gently together. Nope, none of them interfere with the bite, so we'll check his bite now. Are you okay? Yeah. Open, please. Okay. Bite all the way down. And stay together. Open. Close down. And stay together. Open. And bite all the way down. Stay together. And open. So more of the weight is distributed now in the posterior. And even distribution is going to help, help prevent fractures, helps distribute the load over, prevents bone loss. There's so many pluses. Occlusion is key. What we call the bite, occlusion or bite. All right, so polish these up. And see how easy So this morning's appointment is pretty straightforward. Verification of hand tightening, meticulously placing the Teflon tape. So it gave us about a 2 millimeter, 3 millimeter depth scaler. And the 3 millimeter depth allowed us to make sure that we have some resistance to any of these composites coming spontaneously out. So we want to keep everything in and polished. And then using the material that's dual cure. This one is Paracore from the Weldent Coltine company. We've been up and down with a lot of composites, and if anyone is using something differently and they like it, please write in. Tell us what you like to use and why. Alright, so we're going to change burrs here. And I'll just show you what I'm going to do as far as the last polish. I take a Centrix polishing cup. This one happens to be yellow, and I just go over the top of that. So we got a nice, highly plaque resistant surface. And then I'll do the same for the others. All right, that's the end of our program here. We'll see you on the next case. Take care, and don't forget to comment.